Okay, well, our next speaker is Matthew Stoudt. Where's Matthew? There he is, coming down. So Matthew is the CEO of and one of the co-founders of Applied VR. And I spoke a little bit about Applied VR earlier, and what these guys have been doing now for several years is trying to understand really how to, as it says there, make therapeutic VR mainstream, how to implement this technologies in a very pragmatic way in the clinical trenches themselves. So what I've asked Matthew to do is talk a little bit about some of his lessons learned and what are the clarion calls to this audience and to the audience watching on our Samsung cameras here around the world. What do we need to be thinking about to really make this happen on the front lines of care?
Great.
Thanks for joining us, Matthew.
Do you have is this the advancer here?
Oh, yeah, there you go.
Yeah. So thanks, Brendan, for having us here, and also thanks a lot for pulling together this conference. I think it's a testament to where we are in the state of VR and therapeutic VR and medical VR as a whole. Normally when I start off these conversations, I always tell a story. I've got two stories. First story is about the time that I took my mama 500 feet on the side of a building and tried to throw her off of it. That story today was told by Brendan, first time he did it. Second story I tell, it usually starts with the stats around opioids. So one of the stats I always like to say is we're US is 5% of the world's population, but we consume 80% of the world's supply of opioids. And in fact, by the time that this conference is done, over 90 people will have died in the US from a drug overdose. So these are terrible stats, but also Brendan, as he's great at doing, told some of these stats, and I actually hadn't heard the one about the plane going down once a week. I'm gonna have to steal that one from him when he's actually not talking at the same conference that I am. And then some of the other great people up here had some really good, compelling stories too. So I'm going to start off mine with a simple quote that came from Scott Gottlieb, the head of the FDA, who back in February 16 said that healthcare providers need to embrace non-pharmacological measures as a new first line of defense against pain. I think that's a powerful call from obviously someone who is a huge authority in the world of healthcare here in the United States. So the question is, what can we as an industry, I mean this is a collective industry, do to actually make this a reality, make this virtual a true reality in the world of healthcare? And that's going to be both within hospitals and also at the home. So we know a little bit about bringing therapeutic VR to the healthcare system at Applied VR. I'm just going to give you a little bit of a background on who we are and what we do. So we're right now the leading provider of therapeutic VR. We've been focusing on pain management in the healthcare setting, and that pain management includes everything from the actual pain that the patients experience, as well as the psychotherapeutic side of it, because there's a huge comorbidity that exists with both anxiety for acute pain and depression for chronic pain. In fact, tomorrow, Josh Sackman, my co-founder, is going to do a deeper dive.
They're a little loud, but the wranglers need to be working on the mics.
So that's Brendan. Sometimes he talks to me in my head like this. It drives me crazy, by the way. So, so tomorrow you'll hear from Josh, who's going to walk you through our new approach to chronic pain in the U.S. and ultimately, actually, globally. And it's really, we talk about the idea of integrating using a bio-powered platform to drive the experience and then be able to track it. And so we think of this as treatment, training, and tracking. And the use cases for what we're doing right now are truly across the board when you're in healthcare, when you're in a healthcare provider. We're being used everywhere from pediatrics to spine surgery to infusion oncology. Now we're going into pain clinics. We're also starting to go into the home. Brendan mentioned the traveler study that we're just kicking off here. And labor and delivery, that was one that never thought of this from a labor and delivery perspective, but we're actually getting tremendous success with that one. And when we're bringing this to the marketplace, we're trying to bring a holistic solution. One reason why we wanted to go after healthcare providers first and foremost is we didn't have to wait for the consumer adoption curve to hit. We knew that we could actually bring the solution to the marketplace. And so we include everything from the hardware to the software, service and support. And it's some of the software is our own software. Some of the software is software that's created by third-party content creators. And we really view ourselves as that VR pharmacy or as a platform. And as long as it's effective and it can have an impact, I don't care who makes it. I just want to help bring it to marketplace. So in terms of where we are today, we're actually in 42 states. So this is not something that you see just in a Cedars-Sinai or in a Cleveland clinic, but we're actually across almost the entire United States. I just found out yesterday we signed up Montana. I was going to give people, anyone here from Montana, a break on the hardware. You don't get that anymore. But if you are from the states of Idaho, Wyoming, Oklahoma, Mississippi, Maryland, or Maine, we've got a deal for you. We would like to get you up on the map here as soon as we can. We're in over 200 hospitals today, growing every day. And actually, I just found out we're in 7 countries, which actually surprised me. And that seems to be growing all the time as well. So the point of this slide is to say that, one, this is actually starting to go out everywhere. And two, that we've gotten some good insights about VR in a clinical environment. And so what I really want to talk about is what are the key things that we need to do as an industry that can take this from being something that's been clinically studied and is kind of interesting and make it now, and take it from the, wow, isn't that interesting, to that's now mainstream. And there's about 7 steps for that. The last thing is we talked about I think it was Les that talked about the valley of disillusionment. I actually think we're now getting through that, and fortunately or unfortunately, a lot of it's being driven by the opioid crisis. We were in a pain clinic down in Tennessee with the pain doctor there, Ted Jones, sees about 1,000 patients a month. These patients are getting cut off of their opioids. There was even an article yesterday in the New York Times about Medicare cutting patients off of their opioids, but they're given nothing in exchange to help them manage their pain and the depression that goes along with it. And we have this tool that has a heck of a lot of research behind it that now can actually be brought to market in a scalable way. And so the patients are calling for this. The doctors themselves are saying, you're tying my hands. I can no longer prescribe these opioids. I have nothing else to give them that I know can be effective. What do I do? We've got the clinical evidence behind this, and the technology finally is getting to a point where we can make this affordable and we can deliver this to the masses, whether those masses be the hospitals, even the community hospitals, or the patients in their home. All right. Obviously, the ticket to entry for doing any of this is you got to have clinical efficacy. And thanks to the great work of a lot of the people that went before us, and even before Brendan Spiegel and some of the other researchers here, including Hunter Hoffman, Skip Rizzo, I saw you out there, you've done some great work. Walter, obviously, you've done some amazing work. We have the clinical evidence behind this that says, especially in the world of pain management, that this is an effective therapeutic tool. We know it works. We're going to continue to do, obviously, additional research around this, but we know this works. This, though, just because it works, that's only the first step in making this a reality. That's our ticket to entry, as I say. So the second thing is we need to develop a protocol around this. I'll tell you, when we did one of the studies we did at Cedars-Sinai is we thought it would be great as a tool that we can bring up to the patient's bed. We'll let it sit by the bedside so that they can reach over and grab this at any time they want. 2 problems with that. One is our audience, especially in the hospital, tends to skew older. And there is some fear that can go along with adopting new technology on this front. And actually, the odd thing about this is, even though there is this fear of that technology, we also have found in our tests that that's actually one of the audiences that can benefit the most from this new technology. But the other thing is, think about it this way. If we don't have a protocol, if we don't think about the way we prescribe this to the patient, or help give the doctor tools to understand this, how to use this, it's like giving someone a bottle of pills and not giving them any direction in terms of what to do with the pills. Just put the bottle of pills by their side or set a syringe by their bedside and say, use this whenever you want. Am I supposed to take 1 pill 10 times a day? Am I supposed to take 10 pills once a day? I don't know what to do with this thing. So if we really want to make this mainstream, we've got to develop these protocols around how doctors and patients are supposed to use this as a part of their core curriculum inside the hospital, or again, I'm going to come back to this, at home. 3, we have got to embed this in the workflow design of healthcare. I don't care how clinically efficacious the solution is. If it's clunky, if it's hard to use, and it's not optimized for the way that doctors actually do their job, it's going to sit by the bedside and it's never going to get used. It's going to gather dust. And so we need to make sure that we think about, this goes back to having the protocol, and also we need to think about ways that we can also embed this into the EMR of a solution. When we first started coming to market, the last thing we wanted to do was touch that EMR. Anytime you go there, I feel like it's the Venus flytrap. It's going to suck the life out of you, and you're not going to be able to do anything because it's going to take 2 years to just try to get through the initial testing and implementation inside that healthcare provider. But if you really want to drive change, you've got to be embedded in that, ultimately, that EMR, so that the doctor or a practitioner can say, make sure you actually give this to the patient when they're actually calling for that morphine equivalent, or in the morning when they wake up, or 3 times a day, whatever that protocol is going to be that we create. We have to embed it inside that EMR so that the staff can actually follow up on it. 4 is we've got to improve the technology, and this is my own personal bailiwick. We've got to get better connectivity inside the hospitals themselves. The reason why this is important for the technology perspective is that and Samsung, by the way, has been a great partner of ours. But I'll tell you, the number one complaint we get today around the technology is the fact that they've got to take the mobile device, and it seems simple and it seems easy, and I've done it thousands of times, and it still screws me up. But to simply that process of taking it, plugging it into the headset, putting the thing back on, putting it on, you sit back, is it working? Is it? I don't know if it's on or not. Is it patient? What do you see? It's complicated, right? And we do everything we can to make this easy, but it's still complicated. But that's changing. The technology is getting easier and easier to use, and I think as people become more and more aware of it, I think it's going to only make it better. And the second half of this is on that connectivity side is we need to understand if it's actually being used, how it's being used, and be able to get that feedback back to the mothership, whether that be to the practitioner, the provider, or to us and the development staff as our community as a whole, because we need to understand from that digital footprint how we can make it better, how we can make the experiences better by getting that data. It doesn't have to be real time, but we just need to be able to get the data in some form or fashion. Now, this is a big one. One of the questions we get most of the time is, this is great, I think this is going to create a lot of value, but how is it reimbursed? And today, this is starting to change, but it's not reimbursed yet. And so we're doing all these great clinical studies. They're showing that clinical evidence, but we need to start now bringing into the equation what's the economic impact that we're making, especially as we're going into a world where we're thinking about value-based pricing, and you have such sometimes I'd call it animosity between the payers and the providers. What you need to do is you need to find alignment between the 3 core constituencies here: the provider, the patient, and the payer. So we're already starting to work with a couple of these. Anthem, we're doing a project in the state of Nevada right now where we're looking at trying to reduce resource utilization inside the emergency department. The second one is, you just mentioned travelers, and we're actually getting ready to launch a couple more pilots with some other major payers here. But I think we really, as an industry, we need to bring them into the equation and try to make them our partners in this and get over some of those barriers that exist between them. And I'll tell you, just point blank, one of the payers we've been working with, what they've said to us is, we do not want to give any more reimbursement to the provider. Man, if you just walk in with that attitude, that's a tough one to solve, because they keep thinking that the providers are going to turn around and just add one more thing onto that to see which one of the 15 different things they get reimbursed for. So if we can bring them into the equation, we can help them be our partners in this, I think we can move the needle a long way. The other thing is, as we think about the change in from that to that value-based pricing, this whole notion of fee for service and how we get reimbursed today is absolutely going to change. And just one last comment about this, with the 21st Century Act, the more that we can tap into the technology and connectivity and provide data back to the practitioners, there's actually, for that, we call that remote patient monitoring, that actually is a pathway today to how we can find a reimbursement and help accelerate the adoption of this in the marketplace. This one is, I think, critically important, because this is a behemoth, convoluted, complex, crazy thing called healthcare in America. And so the only way we actually really drive transformational change is by building meaningful partnerships. I'll give you a couple examples of what that means. One is, as an example, the work that we've been doing with Ben and Spiegel and the team here at Cedars-Sinai has been phenomenal in helping us identify how we can actually make our product better. They happen to be equity investors in us, and I think that's been a nice benefit for us. But we've also been able to forge similar types of partnerships with players like Boston Children's Hospital, where they've helped us identify a major problem with children going through MRI. And this is one where one of the top-ranked pediatric hospitals, they knock out 90% of the children that are going to go through an MRI without having any understanding of whether that child is going to have a panic attack or not. And I think that's, and part of that is the economic side of this, right? They say, well, if the child comes in and that child ends up having a panic attack, we're going to lose that time on the MRI. The family's going to go home. They're going to be frustrated. They're going to come back. And so it means that we need to, we're going to lose money on them, and so we'd rather just knock everyone out. That absolutely is the wrong approach to take. I understand why they do it, but now we have tools that we can develop. So by having a close partnership with someone like BCH, we're able to identify these potential challenges that they have and come up with innovative solutions. The other one, though, is you go back to the payers. Brendan showed that slide that included Samsung, Travelers, Bayer, and ourselves. And not the most likely people you would expect to see on a slide, but each one of those has a role to play in terms of how we're going to try to drive change here, whether it be from the economic side of the equation, understand how we can impact patients in their home, all the way to trying that digital pain kit to be able to deliver something to someone's doorstep. Next one is we have to enlist the KOLs to start blowing their horn about the role that VR, and I know you use VR, AR, mixed reality, has to play in healthcare. We've got to go out there and whether it be partnerships with the Milken Institute or with the ACOG in the world of labor and delivery or AHA, we need to absolutely go out there and get them on our side, do everything we can to try to get them engaged and start helping us bring this to market and help the payers recognize that this is a viable, real solution with real evidence behind it. And this last one is something that I believe that, one, any startup has to absolutely have, but two, something in this world of healthcare where it can take you 2 years to even get something into a hospital, which just seems crazy to me. We have to have a shared sense of urgency. And one of the stats I threw out when I first started off here was that by the end of this conference, 90 people will have died from a drug overdose. Lives actually depend on all the work that we're doing here. We need to have this shared sense of urgency that every day in every way we're going to aggressively try to push this forward and not simply sit back and wait for change to occur. We have to bring the change to the marketplace. So there are a couple of things that we always get questions around. I think they're open issues that you want to ask yourselves. One is, what is the role of legislation and lobbying? And by the way, I don't come from healthcare. I'm just dumb enough to think I can make an impact. And if I had known now who knows if I ever would have gotten into this thing, because it is just crazy. So these are things that I'm trying to figure out myself right now, but we're talking to a lot of the experts and trying to understand this. So one, what is the role of legislation and lobbying? It goes back to what just happened with Medicare and Medicaid, and now they're cutting off the opioid patients. We've got a tool right now that can actually benefit this population. And so what is the legislation we need to bring to the table or the lobbying we need to bring to the table to help get Medicare and Medicaid on our side? Two is, what's the role of FDA regulation in this? They're going through the pilot program. Samsung is a core partner of their digital pilot program. So how is that going to impact what comes out? And the other thing is, just because you get FDA clearance, someone just told me recently, it was at the payer side, they said, yeah, that's the easiest part in this whole thing for reimbursement. That's just your first step for reimbursement. Then you've got to go out and you've got to start pitching and selling to all the payers in all the different states. So is it actually important, or can we actually bypass that and start going directly to the payers and do some of these studies that we talk about for that economic value proposition? Three, what's the role of self-insured plans? I'll give you one of the examples here. There's a company called Omada that I think has a great business model where they're going out and basically they get paid from their self-insured plans by every pound that they help an employee in a company lose. But the reason why that's effective for them is because it impacts more than a third of the population of the businesses. In the world of pain and some of the other areas for therapeutic VR, we may or may not impact a third, and yet this is a trend that's going toward how companies more and more are taking that route of self-insuring themselves versus relying on the third-party players like the Cignas, Anthems, all of those to take care of their employees. And so how do we sell into them? And then obviously, what's the future of Medicaid, Medicare? And I got to tell you, One of the notions they have is trying to actually distribute Medicaid out as block grants to all the different 50 states, which now as an innovator and a startup in the marketplace, I think that's the craziest thing in the world, because I now suddenly have to go to sell to 50 different partners to be able to get this thing to be scalable in the marketplace. Finally, how can you guys help? I think Brendan sent me a list in advance, and a lot of the speakers up here in advance, talking about the different types of players that are here, everyone from obviously startups to practitioners to therapeutic VR platforms to investors. And all I can say is we are here, we're open. If you have ideas of how you can partner, we want to hear from you. From the VR companies, sometimes we get asked questions about who's our biggest competitor, and it is not the other therapeutic VR companies. We view them as our collaborators. We want to help get them to market. If I can put them on our platform, that is great. We want to do whatever we can, because the real competitor to us is the status quo. And that's why we need to do all the different steps here I talked about to be able to affect that status quo. So with that, I'm going to quickly just put up here's my cell phone, my email address. Anyone wants to do anything with us or just get feedback on how they can help it. We had a hospital from the Netherlands reach out to us and ask us about our experiences in bringing this to the marketplace. And we are happy to share with anyone and everyone the protocols that we've established, as well as help them understand how they can implement it, even if they're not using our own technology. So it's important about having that collaborative approach. We're here to try to help make the world a little bit of a better place. We think therapeutic VR can do that, but we need all of your help to go and make this mainstream. So with that, if there's, you guys find me outside. Look forward to chatting with everyone. And again, Brennan and Walter and all the other people that have gone before us, you guys have been awesome, and we love your support and love the work that you guys are doing, and we want to keep helping drive this world forward. Thanks.